operations have been affected since March 2020 by COVID-19. Firstly, we were disrupted in terms of activities. We had to cut off all activities, face-to-face interventions, which was very difficult for most of our organizations in the health sector, because most of our work rely on meeting the beneficiaries, getting to where the communities are. So most community-based organizations faced that challenge. Yes, there was talk of working from home, operating from home, which was also quite difficult because our communities, you can't access them online. Secondly, we couldn't even start knowing how to communicate. Today is much easier now because we now have Zoom meetings, we have online meetings, but I'm just reflecting back in 2020 when the COVID-19 lockdown was announced and we had to start saying, what do we do? But as a sector, we also realized that most of the communities could not also get their supplies, the essential supplies of medication. We talk of the chronic illnesses because most stocks were as per when the lockdown was announced. And these were some of the issues we began to collect from the communities, that people could no longer access their usual medications.
Access to communities was limited because of the lockdowns that were in existence since last year. And as an organization, we could not reach the target groups that we wanted to reach physically because the districts that we operate in are remote, and use of the virtual avenue is somehow limited because at the grassroots level, most of the beneficiaries do not have even a cell phone, neither do they have a radio to listen to. So one way which we were affected is we could not reach out to the targeted figures that we wanted to reach. And coming on to the communities that we were working with, since movement was very much limited and it was coupled with a drought year, access to food was a challenge to the communities because the organizations that were helping out in terms of food handouts were somehow limited, and we could not reach out to all the deserving beneficiaries. So it was very difficult to access food for in the communities. And those who relied on cross-border ventures, they could not cross the border because the borders were closed. In our communities, especially in Mbire, we are at the boundaries of Zambia and Mozambique. And the boundaries are somehow porous because there are no proper entries and exit points into Mozambique and Zambia. So we had high cases of people who were jumping the border, trying to reach out to livelihoods means across the borders. So our district was somehow prone to COVID-19 because of the porous borders in the communities.
Pregnancies, and for some children, they had to resort to some activities that complemented or supplemented household incomes, as most parents had lost their livelihoods. They were no longer, for women and some men, they were no longer trading in the informal sector. Vending was stopped. And for some in the formal sector, you are aware that there were no jobs. People were sent home, work from home, all those things. For us, this situation compounded a situation that we normally face, where we find abusers housed in the same house with the vulnerable. That put our children more at risk because they are now restricted or confined in a home for longer hours than anticipated. And obviously, one thing will lead to the other. Imagine a child who is going through sexual abuse, sexual exploitation every evening, and that perpetrator is now stuck with you for longer hours than before. That becomes very scary and disorients children, and it affects their development. The obvious gap between the rural and the urban learners was increased during COVID time, as obviously the urban affluent families could quickly grabbed the opportunity to do e-learning, whereas our vulnerable children, whom we stand for, they were exposed. They do not have those gadgets. One, they do not have the money to buy the bundles for e-learning. And then thirdly, they do not have networks in their rural constituencies where they could say that they could also access some of these learning materials. So that gap was actually evidenced at the grade 7 results. If you analyze grade 7 results for 2020, you realize that there is that huge gap. The rural student was poorly affected, whereas the urban one, yes, there is urban poverty. There are some urban students who were equally affected because of poverty. They could not access e-learning, they could not access virtual lessons, and they don't have those smartphones, which is a gadget that is quite pricey for the majority of poor families. So that gap is an evidence at grade 7, at O level, and at A level. So it's an area of concern to us, especially when we look at vulnerable children. Or imagine somebody who wants to go to the hospital, the movement is restricted, you are on art, and you have been raped, you want to access post-exposure prophylaxis. You could not do so within the 72 hours, because then half the time you are retained by the police force without the necessary support documents for you to be allowed to proceed for health services, clinical management of the rape cases. So it also destroyed even the issues of confidentiality, because out of desperation you would end up saying, I have a kid who has been raped and she needs to be treated clinically. You could not do that because you are destroying the confidentiality element in protecting that particular child.
Some of the mitigation means during the pandemic were not accessible to persons with disabilities. Information was not accessible. So information, disaster would strike and everybody would know about Cyclone Lois is coming, Cyclone Idai is coming, and this is how to deal with COVID-19. But persons with disabilities have been on the peripheries with regards access to information. They have not had that information. Going forward, we must plan inclusivity in that regard, and that we make sure that the information that we package is accessible to persons with disabilities and is available to them in accessible formats, especially in connection with thinking about persons with visual impairment. We're thinking of such things as brain, such things as audios. With regards to persons with hearing impairment, we're looking at such things as sign language. A lot of information has been out on TV and on radio about the disasters, but persons with hearing impairment have been left out. So we have to make sure that going forward, we cater and close that gap.
Lessons learned from the pandemic is that there is need for a collaborative effort between or amongst CSOs in terms of fighting this pandemic, and also there is also a need for CSOs to partner up with relevant government ministries because of perhaps resources shortages from either parties. This helps to alleviate any problem that could have been faced, and also to recommend to bodies such as NANGO is that there is need for them to look at strengths that each organization has in terms of fighting this pandemic, and also there is need for them to avail resources where possible to these organizations, because we have noted that the COVID-19 pandemic are really hit hard in terms of some of the resources that these organizations had.
I would also recommend that and the development partners work together, because there is somehow a competition amongst the CSOs, but we are not there to compete. At the end of the day, it's the community that we want to benefit. So we should have a coordinated approach so that we don't duplicate programs in the various districts that we are operating. And as for the government departments, I would also recommend that they take CSOs as people who are complementing their work. Hence, their involvement in the programs, in the various programs, in the various areas is very important. We should have a cordial relationship amongst the various ministries. That will help us make sure that we go we go to the communities as one united body, and by being united, we will be able to make sure that solutions are sought, and we help the communities according to what is expected of us through the humanitarian principles.